What I'm saying is that people don't realize that trauma, I think, is whatever hurts us and harms us. And it often is things that we don't usually think of as trauma. We usually think of trauma as being a sexual molestation or blood and gore, which trauma can be. But it also can be that there's a competition with family members. You might have very bright siblings that you can't keep up with, and you don't want to see jealousy as a trauma.
Mhm.
But if you're in a situation where your self-esteem is being injured, I consider that a trauma, and I work on that in my work with my patients.
Hey everyone, this is Jonathan Marks from Go To Health. Hope you're doing well today. We have a very interesting show with a very interesting doctor. Are you suffering from, or do you know someone suffering from anxiety, depression, perhaps PTSD, or even addiction? Our guest today has done groundbreaking research into what is called dual brain psychology, which focuses on the interaction between the two sides of our brain. His clinical and experimental research over 30 years has shown that balancing the activities of both sides of our brain can treat debilitating symptoms of anxiety, depression, PTSD, and addiction. He has a book which has just come out which will describe all this, and we'll ask him about it. Please meet Dr. Fredric Schiffer, Assistant Professor of Psychiatry at Harvard Medical School, Research Associate at McLean Hospital in Boston, and Principal of a private practice of adult psychiatry in Newton, Massachusetts. Through his groundbreaking work as a founder of the Dual Brain Psychology Institute, he has discovered that the brain is made up of two minds which are competing for dominance. When the immature and troubled half of the brain is treated, dual brain psychology techniques can successfully curb anxiety, depression, PTSD, and addiction, and improve psychological well-being. You can learn more when you visit the website dualbrainpsychology.com. So welcome to the show, Dr. Fredric Schiffer. How are you today?
Oh, I'm well, and hope you are as well.
Thank you. So in your website, you say that all problems come out of early traumas, and very often it's trauma that's not been recognized. Tell us what you mean by that. What kind of problems are we talking about, and what kinds of traumas?
Okay, so what I'm talking about is that when people come to see me, they come, maybe they're having a depression or they're having an alcohol problem or an opioid problem or a marital problem. And what I find is that the problem is related and due to early traumas that aren't appreciated as being significant. So what I'm saying is that people don't realize that trauma, I think, is whatever hurts us and harms us. And it often is things that we don't usually think of as trauma. We usually think of trauma as being a sexual molestation or blood and gore, which trauma can be. But it also can be that there's a competition with family members. You might have very bright siblings that you can't keep up with, and you don't want to see jealousy as a trauma.
Mhm.
But if you're in a situation where your self-esteem is being injured, I consider that a trauma, and I work on that in my work with my patients.
Got it. So define trauma for us. What does that mean?
As I say, I think trauma is whatever injures us.
Hmm.
And what I'm saying is that it can be someone who picks on us or insults us, and we often don't consider that traumatic. That's
Hmm.
just the way life is, and we forget those things that happen, and then they set us on a path for more trauma.
Got it. So you're really talking a lot about emotional traumas or mental traumas as opposed to physical traumas. You're saying these emotional traumas are equally as important as anything physical that happens.
Yeah, but also physical traumas can be significant. In other words, that I have patients who had violent fathers and threw them down the stairs. And so that is traumatic as well. That is usually more recognized. Now, when the patient comes to see me, he often doesn't consider that as a trauma. He's not thinking that. He's just an alcoholic. So physical traumas and physical intimidation are definitely severe traumas.
Understood. So I know you've studied cerebral laterality. What is that, and how can that be used to treat symptoms such as depression and anxiety and trauma? What is cerebral laterality?
Okay, well, as you know, we have a left brain and a right brain. And that's what the laterality is, left or right. And so the brain is sort of looks like a walnut and has two wrinkly halves and a stem in the middle. And in the 1960s, there was a group at Caltech that won the Nobel Prize for, they're called the split brain studies. And they cut surgically the stem between the two brains in people who were having intractable epilepsy as a possible treatment for the epilepsy. And it did help the epilepsy, but what was the Nobel Prize awarded for was that in these individuals, they clearly had two different minds. And you could communicate by putting an image on one side of the person or the other, and the image would only be seen by the opposite brain.
Mm-hmm.
And so these split brain studies were very important. In other words, what it really showed was that each brain hemisphere, the left brain or the right brain, can hold an intelligent mind. So what I discovered was that in normal people, I could stimulate one brain hemisphere or the other with this very simple technique. It was just covering one eye and half the other eye. People respond to this very quickly. And so the first time I tried it, a Vietnam vet who had PTSD and he was doing better. And I asked him to look out one of his lateral visual fields. And he actually was looking at his right lateral visual field, which stimulates the left brain. And he said, that plant behind you looks like the jungle. I said, really? But look out the other side. And he smiled. He said, no, that's a nice looking plant. You can try that if you want, and your listeners can try it. And I have sunglasses that we're having made that have an opening here. So I use these in my therapy. And so I can have a person look out one side and talk to the traumatized hemisphere. That the other thing that I discovered is that the trauma seems to get stuck in one brain hemisphere rather than the other. Uh-huh. So if somebody's coming to me because they're using opioids, I can have them put these glasses on and their cravings on one side would be 9 out of 10. And on the other side, it might be 2 or none. It's a very quick response. And right now, we're conducting a phase 2 NIH study for the National Institute for Drug Abuse, where we're putting an LED, it's called photobiomodulation, and we put it over the positive hemisphere. So we use this eye test to see which is the positive hemisphere. And right now, we're going to finish the study at the end of November, but we're seeing that about a third of the fentanyl abusers, fentanyl addicts, are actively using, when they come into the study, fentanyl, which is 50 times more powerful than heroin.
Yes.
And these people are very deep into the addiction. So we think that we're going to have good results. And we have an earlier study, also funded by the National Institute for Drug Abuse, where we just studied cravings, but this was heroin addicts. And in that study, there were 40 subjects, and there was a huge difference between the active and the sham groups. Just putting a light for 4 minutes over the positive hemisphere.
And when you say the positive hemisphere, what's the positive hemisphere? Is that the one that's affected where the trauma is?
Yeah, it is. It's where the trauma is. And we determine that with this simple visual test. Someone will have their symptoms looking out this side, and they'll feel more anxious, and looking out the other side, it might feel much better.
So you have developed this concept called dual brain psychology, which is what you've been describing. And what you've also been mentioning sounds like decades of research, of clinical research that have proven this approach.
Yes.
Tell me more about this psychological approach and what you do with patients.
I call it dual brain psychotherapy. In the therapy session, I'll talk to two different people in one person. And I'll use the sunglasses, or you can just use a letter envelope or your hands. I prefer, and the patients seem to prefer, the sunglasses now. And so if the patient look out the side that stimulates traumatized side, and I can talk with that person. For instance, yesterday I was having a conversation with a patient who was bullied severely in his past. He's now an adult in his 50s and came for anxiety attack. And what we found was that on one side, that mind is still waiting for the bullies to come. And the anxiety was about. At the other side, he knows that there are no bullies now. And it was something that happened in a different environment and a different situation. And so I have him look out his positive side and talk about how he feels. And then we go over to the other side, and I'll ask that side, I said, did you notice how you felt over there? And so we're trying to work with the traumatized person and get it to see if he can sit with the anxiety rather than flee from it, and understand that it really wasn't his fault, that the anxiety is normal. Anybody who's in a dangerous place should feel anxiety, and that what he's misunderstanding is that he's safe now. But when someone has severe trauma, the salience of that trauma makes it hard for this traumatized brain, which is also more childlike. So it's like a child that you can tell that it's safe now when they've been injured, and the child will say, oh, yeah, okay, but they don't really believe it. And that's what the therapy is about, work with this disbelieving person inside.
So let me tell you where you can go to learn more, and then we'll ask some more questions. You can go to dualbrainpsychology.com. It's dualbrainpsychology.com. Okay, and people can learn more. You have a book. It's called Goodbye Anxiety, Depression, Addiction, and PTSD, The Life-Changing Science of Dual Brain Psychology. What is covered in your new book? Can people learn more about this if they can't come to see you?
Yeah, and it's on Amazon. The book is intended for lay readers. And so it's substantive and very meaningful, but it also is not a heavy read. So it's told more as a story. There are a number of clinical vignettes, examples of my doing dual brain psychology or therapy with patients.
Great. Dr. Schiffer, what message would you like to leave people with today before we close?
But I think the best thing is to go to my website that you've described, and there's more information there. And if it interests you, then you might get the book, and you can email me if you have questions, and you can email me through the website. I think it's extremely powerful and helpful. And I'm very hopeful about our being able to promote it properly.
Got it. And he not only thinks it, he's proven it through clinical trials. Great. Good. So we've been talking, and I'll just name the website again, dualbrainpsychology.com. And we will put a link to that website on our page with the interview with Dr. Schiffer. And I'll also find the place where you can buy the book on Amazon. I'll also put that link on our website as well. But you can find that if you go to dualbrainpsychology.com. Thanks so much for being with us today, Dr. Schiffer. It's been really a pleasure and very interesting to talk with you.
My pleasure. Thank you.
Good. So we've been talking with Dr. Fredric Schiffer. He's an assistant professor of psychiatry at Harvard Medical School. He's a research associate at McLean Hospital in Boston. And he also maintains a private practice of adult psychiatry in Newton, Massachusetts. This has been Jonathan Marks. Remember, you can watch us on YouTube. You can listen to us on 8 podcast networks. You can subscribe to us at our website at go2healthmedia.com. And as we say at the end of every show, go to health. Take care. We'll see you again next time. Bye. Thank you for tuning in today to Go to Health. You are one of almost 10,000 people per day who enjoy the evidence-based health information offered by our guest health experts. You can watch us on our website and YouTube and listen to us on 8 podcast networks. Be sure to join Jonathan Marks in our upcoming shows each week. If you like our show, Please share this episode with your friends and colleagues. You can subscribe to the show, join our email list, send us feedback, browse through the online store, and view our library of over 150 shows at gotohealthmedia.com. See you next time, and remember to elevate your life with Go to Health.